We're here at the University of Toledo Medical Center tonight, Dr. Kris Brickman. I'm going to talk a little bit about pain. Pain you might be able to deal with, pain you might not be able to deal with. Let's talk about head pain and when people come in with trauma. If they injure themselves in any kind of fall or any kind of accident, when is the best time to start thinking about going to a doctor?
Well, kind of depends on the circumstances. You know, just banging your head doesn't necessarily make it an emergency, Sean. You know, it's more if you have other symptoms, other problems that kind of occur along with that. So whether you get hit on the head with something, whether you fall, bang your head, whatever, doesn't matter the mechanism as much as do you have any nausea, vomiting, do you have any blurred vision, do you have any kind of neurologic symptoms, numbness, tingling anywhere, are you dazed, confused? Did you lose your memory? If you have any of those things happening, you probably shouldn't be waiting to get that checked out. So
what about consciousness? If you lose consciousness, is that an automatic to go to a doctor?
Yeah, pretty much. If you've been knocked out, you know, I pretty much have to recommend that you go get that checked out.
Okay, but so when it comes to like nausea and things like that, I mean, that just might be a reflex of being scared about it, right? Or is it more a neurological thing?
Well, and that's exactly right. You know, everybody is somewhat nauseated after banging their head, and everybody is a little bit sleepy. There's a bunch of wives' tales out there of just, geez, don't let them go to sleep. You know, you got to keep them awake.
I think is the one that's key with that. I know when my daughter hits her head, we always got to make sure she stays awake for a certain amount of time. Any truth to that?
No, that's crazy. You know, there's no need for them to have to stay awake at all. What you want to be able to do is monitor them. You know, they're going to be tired. Their brain's got a little bit of a bruise. It just wants to rest. It's okay to let it rest. You just got to make sure you can wake them up. You check up on them periodically and make sure they're still acting okay. They know you're dad, and they pretty much are responding appropriately. If they're listless, they're not responding, they start vomiting, they need to get that checked out.
Okay, and that's just a straight ER visit. It's not something you want to wait to talk to the pediatrician for? Do you want to take them right to the ER, you feel like?
And truly, if they are unconscious, yes, you go right to the ER. If your kids bang their head and they start vomiting, yes, I would go right to the ER. Probably would not be running that by, you know, the pediatrician. The emergency department is pretty much where they need to go. If they've had a head injury and start developing these other symptoms, I wouldn't want to be waiting for the pediatrician to tell you to do that.
Okay, what about long term? I mean, if you hit your head just in a common setting and you don't go to the ER, is there any kind of worry down the line that there could be further effects?
Well, there's always a worry, again, depending on the type of injury and how significant that injury is. For the most part, the ones we're talking about where you're just kind of watching that thing at home, that is not a concussion. Again, you haven't lost consciousness, you haven't had a number of other symptoms, so those things pretty much all resolve themselves within a couple days. It's if that hasn't resolved, meaning headache, vision issues, you know, feeling foggy like you're in a fog, if that hasn't resolved in 2 or 3 days, you do need to get that checked out and followed up by your doctor at that point if that hasn't cleared up.
All right, good information talking about head pain today, Dr. Brickman. Coming up next week, we're going to talk about chest pains and some of the key things you need to watch out for today. That is your Talk Back.
Good information there.